So I just walked into the pharmacy, to buy some drugs. So on the counter, I saw some leaflets. I just saw prostate cancer, screening, surgery and all whatnot. So then I just called one of the numbers on the leaflets. But I've never had the opportunity of going for prostate screening. So I think this is a very big opportunity for me. I said I wouldn't miss it.
50-year-old Noel is at this health facility for a free health screening. Like him, thousands of Lagosians eagerly wait for free or subsidized health missions by government or private institutions.
If you go to an hospital, it takes you a lot of time. But as we come here today, I can see that things were very fast. And I can see the treatment, the doctors, the way they are attending to people, and the drugs they gave to us, because we've been going to hospital, we've been seeing what we have been given, and we saw that there's no difference. So I'm very, very impressed, and I think this program will continue.
The National Health Insurance Scheme, Decree 35 of the 1999 Constitution, states that every Nigerian must have access to improved healthcare facilities. Taking a census of access to the public hospitals, the reverse is the case, as the vacuum is felt in most states. However, access to services is just one dimension of universal health coverage. How much people pay for the services is another.
And since February, I've been on dialysis 2 times a week because I couldn't afford the times of 3 times a week.
The money is not so much an issue because compared to private hospitals, government hospitals are a lot cheaper.
Most of the service there is not encouraging. If you get there before they attend to you is a problem. The way the nurses will harass you, the way they will attend to you is not welcoming. Even the attendants is not something to talk about.
Lagos population is about 21 million, with less than 30 general hospitals and over 40 primary health centers. No doubt, the growing population increases the demand for more health facilities.
General consensus is that lack of finance was not only the barrier in accessing health care. Many people that have the money hardly get health care as at when due.
Medical doctors who own these private hospitals work in the general hospitals. So in that light, it actually means that you're actually just wasting your time going to the private place, because the only difference is probably in some of those private hospitals they have some machineries or machines which they don't have in a private or government hospital, on the public hospital. But I think it's getting better now, because really if the human resource to handle the machine is actually working in the public hospital, what is the essence if you go to a private hospital, you don't meet a gynecologist, they will tell you it comes only on a Tuesday or a Thursday. It doesn't make sense.
They have phobia of going to the hospital. Many people, if you talk to them that you are sick, go to the hospital. They say, I don't want to go to the hospital because of the way that nurse will harass me.
Health center tẹ́mi ń lò ní Ìṣẹ́rí ọ̀nà gọ́dọ̀, wọ́n attend sí mi dáadáa, wọ́n dẹ̀ ń dá mi ló, kódà ìyàwó mi tó bá lọ sí clinic yàtọ̀ sí pé kó gba card, wọ́n gba owó lọ́wọ́ ẹ̀, wọ́n dẹ̀ gbẹ́ nìtì lọ́wọ́ ẹ̀, tá bá ti débẹ̀ wọ́n máa attend sí wa dáadáa.
One state keen on setting the pace in the area of improved health care is Lagos State. Before now, the state free health policy was in place, but it lost its steam.
The free health policy was established by past governments as a way of addressing that financial protection to the poor. We also do know that the free health policy did not work, did not achieve its aim. Nothing is free. One reason is that the budgeted provision to the health sector is totally inadequate. There is no way you can fund anything health free without the huge resources. If you trace the the health budgets in any state government, even federal government over the years, you find it's totally inadequate. At the federal level, if you look at the health budget compared to the total national budget, it's less than 5%. Meanwhile, WHO, all of them are talking about 15% minimum. So let us assume that 15% is correct, 5%, 15%, that's not very, very little you can do. The same thing we have tracked in Lagos State for over the years now. Our budget for health has been increasing. But if you break down the budget to capital, recurrent, and personnel, you find that now you needed to take a decision in particular. Do you make it free? You're going to make it free. Okay, you told people are free. They don't have where to go to. They don't have a proper hospital. They don't have anything. So which is the egg? Which was the chicken?
To the benefit of all Lagosians and indeed Nigerians as a whole, can we applaud His Excellency as he unveils this all-important logo?
Taking a step further to ensure healthcare remains paramount through its inclusive healthcare policy, the Governor Akinwumi Ambode-led administration is setting the pace with the Lagos State Health Insurance Scheme.
I can assure you that providing a health insurance scheme for all residents of Lagos State is a very tough task, but one we are committed to executing. We were committed to implementing this program because the welfare of all Lagosians is of paramount interest to us. And we came into office with a promise, to actually make Lagos work for all of us. I'm delighted that we have fulfilled that promise and are gathered at this historic and momentous occasion for the formal launch of this scheme. It's historic because it marks a distinct milestone in the state government's effort to ensure the sustained provision of a critical social service to our teeming population. The overall goal of this scheme is to ensure that all residents have unhindered access to sustainable, quality and affordable healthcare services with financial risk protection, including subsidy from government.
No doubt, the scheme will limit the rise in the cost of healthcare services. One question that comes to mind is ensuring equitable distribution of healthcare costs among different income groups.
I would say management. I would say we need more directed management. And then also enrollment. A lot of people don't know that they are eligible. A lot of people don't know how to even enroll in the national insurance scheme. So we need some effort in preparing people's minds, getting them ready for enrollment, and maybe electronics, allowing people to register online, making it easily accessible, and doing some tutorials would go a long way.
Avoidance of doubt, this initiative is mandatory. That means it's compulsory for all Lagosians to come under this health insurance program. And, technically, just like they'll be telling us, it's very affordable. And then the payment is flexible. You can pay monthly, you can pay weekly, quarterly, annually. And the benefit package is in different formats. But what's most important is that we're placing emphasis on primary care and secondary care. Going forward, you are going to be seeing a lot of enrollment agents in your communities to register residents. Kindly give them your full support to ensure that Lagos State, as usual, remains the trailblazer.
Our people, no matter their socio-economic status, remain the greatest asset of this state. We must therefore ensure that we put measures in place to enable each and every individual achieve their full potential. To this end, the state government has committed 1% of the consolidated revenue as part of Lagos State Health Fund to be used in paying premiums to the poorest of individuals and families in the state. Other sources of funding will include local and international donors, individual philanthropists, private organizations, and the NHIS, hopefully, through the Basic Healthcare Provision Fund. The poor and the vulnerable individuals will be identified through a transparent scientific means testing exercise going to be carried out periodically. Therefore, the number of lives and the productivity lost to illnesses will be significantly reduced.
With the scheme, the Ministry of Health is also putting machinery in place to ensure a high standard of healthcare delivery services within the platform is maintained.
The scheme, in line with the Lagos State Health Law of 2015, will be regulated as administered by LASHMA, who will ensure that the scheme runs effectively and efficiently. The agency will also be responsible for the payment of all healthcare providers for now. The operations of the scheme will be carried out by LSHS accredited maintenance health organizations who will serve as the health insurance agents. The HIAs will be responsible for marketing, registration, and enrollment of all residents of Lagos. A lot of them are reassigned to their various local government areas. The role of the healthcare providers cannot be overemphasized, as they are key to the success of the scheme. To this end, healthcare providers have been drawn from both public and private sector under a public-private partnership model to ensure success and sustainability of the scheme. These selected providers will guarantee quality healthcare delivery to all enrollees. Quality care is one of the major features of the scheme, and the state has designed a quality improvement program for the healthcare providers participating in the scheme. The quality program is designed to ensure that all empaneled healthcare providers continually strive for excellence to meet international best practices. The initiative will be coordinated by the Health Facility Monitoring and Accreditation Agency, HEFAMA, and supported by several partners agencies. For facilities that did not meet the minimum standard to participate in the scheme, these facilities are encouraged to work on the identified gaps and call for a reassessment. To facilitate this, the governor recently and graciously approved the reduction of the registration fee for the private providers.
The premium for the scheme has been determined by the state government, and it comes at 40,000 naira for a family of 6. The family being defined as mother, father, children, 4 children under the age of 18 years. However, we do take into cognizance that there are some people who live in Lagos State and are not married and can come in as individuals. So there is also the provision for individual enrollment, and that comes at a cost of 8,500 naira. We are also aware that there are families that are more than 6. We have people who are married to one wife and have more than 4 children. In such a family, there is provision for additional family members. So for any child that is younger than 18 years, that child will come in at a cost of 6,000 naira per child per year for that policy. Anyone that is above 18 years of age in that family, additional to the initial nuclear family, will come at the cost of 8,500 per person per year. Okay.
The Lagos State government, apparently they are always in the forefront of anything progressive. Healthcare is tough anywhere in the world. You know, it's even UK is struggling with it. It's expensive. I spent 7 years in Canada as a doctor, and it was a struggle. The US, you can see, part of why Clinton was so disliked by physicians is because of what she tried to do in healthcare. It's about 1/6 or 1/7 of the entire economy of the US. So it's very difficult. Lagos State, I trust, will do a good job. The first thing is to have a good census. You have to know who you are going to care for, since it's expensive. Because as soon as you start, everybody will come from Niger Republic, from everywhere everybody will become a Lagosian. So you have to do good census, good monitoring system. And then to sustain it, you have to prevent abuse, because you don't know what provider, who is the provider. You may find somebody just open a little shack somewhere and just be sending you bills. You have to have a good monitoring system. And when you visit them, somebody is charging you for CT scanner and he doesn't even have X-ray machine. So you need to know, you have to have all these checks and balances. And then the providers must be up to snuff, as they say, in knowledge and experience. Because if you don't make the correct diagnosis the first time, you still charge. So you charge 10 naira and you miss the diagnosis. Another doctor will charge 10 naira to get it, that's 20. So you need a doctor who can make correct diagnosis first time. So you pay just 10 naira. Those are some of the major points. But it's going to be tough because it's very laudable project, but it's hard to sustain.
Some of them try to direct your medical practice based on financial gains. Let me put it that way. For example, some of them will tell you which tests you can run, which tests you cannot run, not knowing that the way to make money is not by restricting the doctor's ability to do some needed diagnostic tests, because like we mentioned earlier, prevention, you'll spend, there's a research that shows that if you spend $1 or say 1 naira now, you can save $10 or 10 naira later. So if you allow us to focus on some of these diagnostic tests, you'll end up avoiding some surgeries, some costly drugs, some other things down the line.
Allocate enough funds and make sure that these funds are judiciously and properly used. I think that is it. I think the framework is good. The plan of action is good. I commend them for that. And I think more and more states should adopt that.
Basically, insurance health scheme is good. Life insurance, all those things, they are good. Anything that has to do with insurance, I believe in it. I like it. And I believe when I'm worth it, I would definitely venture into it.
It talks about the total securement of the life of human being, mostly on this side of our continent here, Africa, Nigeria. We really need that type of scheme.
I think what it's all about is like trying to provide a form of finance in such a way that in case you have probably some kind of terminal illness or some kind of things, the insurance is supposed to be able to cover for it at that particular time, especially when you don't have money.